Hi, I'm Tanya from Sugarfit, and today I'll be talking to you about the 5 foods to avoid in diabetes. Anyone with diabetes knows how difficult it can get to keep the blood sugar levels under control. The constant check on your diet, the cumbersome need to carry your glucometer everywhere, requirement to keep sugar pills with you in case of a drop in sugar levels, and so much more. We all know that following a healthy diet can help keep sugar levels under check. But even that can get overwhelming. Constant unhealthy eating and drinking habits may lead to an increase in cholesterol and raised blood sugar levels. Which is why, along with following a diet plan, it is even more important to understand food categories, which foods have positive effects and which are so detrimental that just avoiding them can result in improved glycemic levels and reduced complications. The reason why this comes under the category of what foods to avoid with diabetes is that it can have a direct and damaging impact on the cholesterol levels of the body. This in turn could cause an effect on the proper functioning of the heart. A good way to identify the trans fats in any food would be to check the nutrition index on the labels. Avoiding as many as trans fats as possible would help lead a healthier lifestyle after the onset of diabetes. Some foods with the higher trans fats would include fast food items like French fries, chips of all kinds, sweet baked products like cakes, muffins, cupcakes, mousse, etc. What can you eat instead? Focus on polyunsaturated and monounsaturated fats that do not affect the LDL cholesterol levels like olive oil, sunflower oil, cashews, and almonds. Such grains are also digested quickly, which result in an almost immediate spike in sugar levels. If you're a diabetic, you may have noticed how hyperglycemia can increase the hunger pangs, causing you to want to eat more. The drawback here would be that on one hand, the blood sugar levels are already high, and on the other hand, because you want to eat more foods, the spikes will only increase. This is why processed grains are not recommended for people with diabetes. Rice, maida, corn, white bread, all of these fall under the unhealthy category of food for diabetics. What can you eat instead? Grains with properties of vitamin B and those which are rich in antioxidants can be consumed. Whole wheat or gluten-free bread, oats, quinoa, wheat can be consumed. Certain meats can be healthy, but processed meats certainly fall under what is not to be eaten with diabetes. These are meats that are preserved in unnatural manners, possibly with the use of chemicals. Anything that is smoked or salted or canned is considered processed and harmful. They are linked with various forms of heart-related diseases and even cancer. Recent studies have shown that these meats also increase the risk of onset of diabetes by 11%. The examples are sausages, ham, corned beef, smoked meat, etc. Consumption of these meats, even in a small amount, may be considered harmful for a diabetic. What can you eat instead? Fish rich in omega-3, whole eggs, skinless chicken, and even skinless turkey beef without fat can be consumed. Unhealthy fat can cause an impact on cholesterol levels. This is particularly true if you're a diabetic. It also leads to insulin resistance, which may become problematic, as insulin is important in the proper control of sugar levels. Saturated fats are primarily present in processed foods, animal products, and certain oils. These may not directly come under what food causes diabetes, but they can be a significant contributing factor during the onset and even post-diagnosis. The examples are butter, full-fat cream or mayonnaise, fast foods like burgers, potato chips, and pizzas. What can you eat instead? Eating polyunsaturated fats like salmon or tuna fish, walnuts, tofu, flaxseed could be helpful. Cereals are definitely on the list of what foods to avoid with diabetes. This is because of unnatural high sugar levels and carbs present in these, which also have a very high GI. This causes an immediate and high spike in the overall blood glucose levels. Many doctors also advise the patients about what fruits diabetics should avoid for the same reason of a high GI. The examples are cornflakes, Fruit Loops, Chocos, which have a very high sugar content. What can you eat instead? A cereal balanced with protein, healthy carbs and fiber would be best. Oatmeal, parathas made out of whole wheat flour, vegetable, or a healthy fruit should do the trick. A diabetic food chart need not to be restrictive, and you can occasionally enjoy your favorite food and not worry about its negative impact. It is prudent to remember that apart from what you eat, there are many other factors like portion size, amount of carbohydrates consumed, the type of carbohydrate consumed, the time when the meal is consumed, medications, and the extent to which other lifestyle factors like exercise, alcohol, stress, etc. are impacting your overall glycemic health. An overall goal in your diabetes diet plan should include avoiding liquid sugars, refined carbs, processed grains, and unhealthy fats. Aim to eat foods that won't cause any sharp or sudden fluctuations in your blood sugar levels. Frequent changes in your glycemic levels over time may lead you to develop other comorbidities or complications that make it harder to achieve reversal. Adopting a healthy lifestyle and a good diet plan not only helps in stabilizing blood sugar levels, but also enhances or boosts insulin sensitivity that gradually leads to diabetes reversal. Thank you.